Oncology nursing is a career that has many facets, both scientific and interpersonal. It is an evolving specialty, a progressive growth area, and offers innovative career opportunities. Oncology nurses share a passion for their highly stimulating and extremely rewarding profession.
You know, it's something that you've seen portrayed in movies, you've read about it, you see ads on TV about shocking moments in your life. But when I was told that I actually had breast cancer, it was just a feeling of shock.
When we are first meeting the patient, the main focus is to take that initial health history. But there is often so much fear and anxiety that we provide a lot of support and build a very important relationship right from those first few moments together.
I meet all patients before treatment begins. During that initial meeting, I invite family members to be there. This helps me to get to know the patient and the family better, and to see the family dynamic that they share. By knowing them better, I'm more able to help them. Because a member of this family is sick at home, the family has a lot of concerns, lots of preoccupations. So this meeting allows me to give them support and clear up any taboos and myths that these people may have in regards to cancer and cancer treatment.
I remember my shoulders just kind of coming down as this nurse was talking us through and just feeling, okay, we're going to get through this.
Treatment steps in the cancer journey can include radiation or chemotherapy, where the nurse's role is vital in assessment, follow-up, and intervention.
We continue to see the patients while they're on treatment. We assess them weekly at least, and sometimes more than that if we talk to them over the telephone, to see how both they are doing and their family are doing.
I was very concerned I was going to lose my hair. And I remember the nurse coming in and talking me through what chemo would be like. And I remember saying to her, you know what, I just don't think I'm going to lose my hair. And you know, the nurse could have just shot me right down and said, look it, you're going to lose your hair. Instead, she said, well, you know what, most people lose their hair with this treatment, but maybe you won't. And what she did there was just let me keep my hope. And, you know, it's like she had a lot of knowledge about the disease, but she knew about the person who was going through the disease.
Prior to receiving chemotherapy treatment, a patient will come into the clinic and I will do an assessment on them, and I will specifically check for any side effects that may be occurring due to their chemotherapy treatment. And each chemotherapy on its own can have specific side effects that may occur. So as part of my education as a chemotherapy nurse, I know which side effects to look for particular chemotherapy, and I will advocate for that patient to have support medications implemented to carry them through the treatment, or in fact advocate that perhaps a delay may be necessary.
The care of oncology patients occurs in many areas of a hospital or outpatient clinic. Patients hospitalized on oncology, palliative care, and medical surgical units benefit from special nursing care.
The nurse's responsibility is to look after the skin. If it's receiving radiation, it's very toxic to the skin, and if it's a surgical wound, chemotherapy can interfere with wound healing and the possibility of infection. And the whole package, it's all about seeing the patient as a whole and looking after them, monitoring them for any complications setting in from whatever the treatment modality they've just come through, and bringing it together for them.
An oncology nurse's responsibilities are varied and complex. There is a high level of scientific detail and technical knowledge to be learned. After a nurse obtains his or her nursing diploma or degree, there are many opportunities to pursue an oncology nursing career in many innovative directions.
If you still want to keep on going, there's also the certification in oncology. And then if you're having a more desire to pursue, there's also, I mean, if you don't already have your undergraduate degree in nursing, you could apply for that, and also you could apply for your master to become either advanced nurse practitioner or a nurse specialist in oncology.